All right. Want to maybe lower it? Well,
You can do whatever you want. I'll do whatever you want.
just zoom out just a teensy bit, just a teensy
Zoom
bit.
out.
Yeah, zoom out, and that's probably fine. Yeah, that's good. That's fine.
Okay.
Slightly off. So that's good. So tell me when to begin.
All right. Yeah. Actually, got about another 90 seconds.
90 seconds. Joanna is now part of this. Fantastic. But I'll talk for like 7 minutes, 5-6 minutes, and see. I'll just if there's questions, then we'll answer those. We could be here a bit longer, but we may just have me talking for now. Sure.
Hey, Joanna, can you hear us? Stop that. Yeah, can you talk?
Oh, I can talk now. We on?
Okay,
We're
good,
live.
good,
Oh,
good.
sorry.
Yeah, no, we're
Not live
I
yet.
was just testing the.
Okay, I wasn't sure we were talking to you.
Okay.
All right, so there's that.
All right, you are live.
I am live. Fantastic.
All right.
Hi, Dr. Robert Nucci of Nucci Medical. Today is our weekly coffee talk, and I did bring my coffee. Actually, I drank all my coffee on the way in this morning, so I had just made a new pot. It's actually somebody gave it to me, but I have my coffee, so I'm ready to go. Today we're going to talk about piriformis syndrome, which is one of the causes of back pain and sciatic type pain, and it is not really discussed very much. I've given talks about the common causes of back pain, the common causes of sciatic pain, and what's this and what's that. But piriformis is one of those less common causes of back pain, one of those less common causes of sciatic pain that we have to think about when we have patients who come in with pain, particularly those that maybe you've treated for some other thing, a disc injury or arthritic stenosis or some other reason they may have back and leg pain, and they didn't get completely better, or they didn't get better at all. And you start thinking, well, is there something that it could be, that it isn't that? And one of the challenges with piriformis, as most things in the back, is that they cross. So it's not like you bang your thumb and clearly your thumb is injured. It's back, it could be very different. When an injury here could cover an entire area and it looks like just like an injury here, there's like an injury here, they all give you the same symptoms. So you have to do a differential diagnosis and break it out. And piriformis is one of those. As far as the anatomy of the piriformis, basically, the piriformis is a muscle. It's a muscle in the buttock. It goes to the ischial tuberosity, that's the bone you sit on, and the sciatic nerve goes right next to that, right anterior to that, so right in front of that, so that an injury to the muscle that goes across the sciatic nerve can give you sciatic nerve and back symptoms. And I do have a picture that I'm going to try to make work here. Except when I drop my pen, I can use my other pen. All right, come prepared, right? In any case, here is, if we can zoom in or not, if we can, I'd like to do that. Anyway, here's the sciatic nerve that comes out into, I'll raise it up here, that comes out, okay? And the piriformis essentially is a muscle that goes like that, right across it, not quite as big as my pen, but it can tether the sciatic nerve. So it can tether it, pinch it, and it cause pain in both the area of the sciatic nerve and in the back itself. So we can zoom out again now. So what does this mean, and why are we concerned about this? Well, I mentioned in the original note out that it's a great mimicker, and it can. You can have piriformis pain and have low back pain. And you can have piriformis pain, and because it's pressing the sciatic nerve, or it can press and tether the sciatic nerve, sciatic type symptoms. And both of those things, when you have someone come in with low back pain, or somebody come in with sciatic pain, or even pain in the back of their thigh and the buttock and so on, the first thing you think about is not piriformis pain. You think about disc herniation, you think about arthritis in the back potentially, you think about muscle injury, you think about facet pain and disc pain and all these other much more common things that also can give you back pain and leg pain. So it can mimic all of those. And certainly if you have a patient come in and their spine and everything is pristine, it may be easier to make the piriformis diagnosis, and we'll go into exactly how to do that in just a second. But when they come in and they have all these other things, you start thinking, well, it's this kind of pain. You think of the common causes, not the less common causes, but it can give you both back pain and leg pain. You see that in a chronic situation when you have people who are sitting for long periods of time, taxi drivers, Uber drivers, I suppose, sitting for long periods of time, putting pressure on those ischial tuberosities can inflame the piriformis. The piriformis becomes inflamed and it bothers the sciatic nerve. It can give you pain down the back of your thigh, numbness, tingling, burning, and can give you back pain also. From a traumatic standpoint, you can get it on an accident, a fall. If you flex your hip and has it forcibly internally rotated, towards your knee more towards the midline, you bend your leg, your knee towards the midline, from a fall or maybe a twisting, hitting the dashboard, this kind of thing can give you pain in your injure your piriformis and give you pain. So those are the most common causes. There's other causes. Those are two most common: traumatic and chronic. As far as making the diagnosis, you do the regular physical examination and so on. You're looking for the different common causes of low back pain and so on. One of the piriformis tests there's a couple of them. One of them that's easy to do is you're bending the knee up and you're stretching the piriformis. So essentially what injured the piriformis from trauma, where you get your knee bent and internally rotated and your hip gets stretched, that's a piriformis test. You do the same thing and stretch that piriformis, and that can give that buttock pain and even pain down into the leg. Another one that I think is that's actually fairly clever is have a patient lie on their side, bend their knee, and then try to lift their knee off the bed. That also can give pain in the piriformis muscle. And just pressing on the piriformis too, because it's in the ischial tuberosity, or you press near that, and that too can cause pain. But it's often a diagnosis almost of exclusion. You do these other things, and unless it's crystal clear, you start looking at these other more common causes first. But if they don't improve, you start looking at the piriformis and some other less common causes of back and sciatic pain. As far as treatment goes, the treatment for piriformis pain is generally non-surgical. Surgery doesn't work that great for this. Taking off the piriformis muscle, and doesn't work too great. But you can do stretching exercise. So again, the exercise that actually caused the pain, doing a slow stretching in that same kind of way on your own at home or with a therapist can help. Anti-inflammatories and piriformis injections actually help really well. It's an injection. It's a trigger point injection. Trigger point injections are injections into the muscle, the neck and back and other muscles. You can inject the piriformis. It's also a muscle. It's it's like a triangular muscle actually, and you can inject the piriformis, and that does help quite a bit. And then the stretching exercises after that, anti-inflammatory, usually does the trick. There are other ways to diagnose it with EMGs, but unfortunately they're not non-specific. It's not super helpful, at least in my opinion. And MRI, you can MRI the piriformis, not something we normally do, but it's also difficult to make that diagnosis. If you see an inflamed piriformis, you might be able to make the diagnosis that way. But again, difficult to do it. It's a difficult diagnosis to make, but if you keep it in your mind, you can have it. So in trauma, you can see it, sitting long periods of time, falling, twisting your leg, all those are causes of piriformis muscle pain. And as I say, it can mimic sciatic pain, disc herniation pain, because it pinches the sciatic nerve, so you get sciatic symptoms. It's in the back of the buttock area, you can get it tight, and you have low back pain. And you can have both, which you need to make the diagnosis of what's causing it. Is it the back? Is it the sciatic nerve? Is it what is it? Those are the best ways to do it. But the most important is to keep in your mind that is one of the causes you need to be concerned about. So that's a little bit about piriformis pain. I don't know if anyone has any questions today about piriformis pain, but I'd love to take them if you do. And I'll have some coffee while I'm waiting and maybe considering the question. All right, well, I don't know if we have one from them or they're contemplating what we did, or what we said. Piriformis pain, that's one way that's where we diagnose this. I believe we have a video also on our website about it, and maybe even one about treatment too. So thanks for the coffee talk today. Next week, we'll do another interesting topic you guys have asked me to talk about. Nice to see you. Have a good afternoon.